Question 1, scenario-based. Musculoskeletal conditions and patient assessment. Mr. Ramirez, a 68-year-old male, presents to the outpatient physical therapy clinic following a total knee arthroplasty (TK) 3 weeks ago. He reports significant pain, 7 on the numeric pain rating scale, and stiffness, limiting his ability to actively flex his knee beyond 60 degrees. The physical therapist's evaluation reveals edema around the knee joint, palpable warmth, and a visible antalgic gait pattern. Mr. Ramirez expresses frustration with his limited progress and is anxious about his ability to return to his daily walks. During the initial treatment session, while the physical therapist is occupied with another patient, Mr. Ramirez asks you, the physical therapy technician, if you could apply a cold pack that he saw another patient using, since it appears to help the other patient. What is the most appropriate course of action for the physical therapy technician to take first in this situation, considering the patient's condition and the PT technician's scope of practice? A. Apply the cold pack to Mr. Ramirez's knee for 1.5-2 minutes, ensuring proper insulation to prevent skin damage, and document the application in the patient's chart. B. Explain to Mr. Ramirez that as a PT technician, you cannot independently determine the appropriateness of a cold pack without consulting with the supervising physical therapist, and then immediately inform the PT of Mr. Ramirez's request. C. Politely Mr. Ramirez's request, stating that you are not qualified to administer cold therapy, and suggest he wait to discuss it with the physical therapist during his next scheduled appointment. D. Check Mr. Ramirez's chart for any contraindications to cold therapy, e.g. cold sensitivity, Raynaud's phenomenon, and if none are present, apply the cold pack and closely monitor his skin for adverse reactions. Answer. B. Explain to Mr. Ramirez that as a PT technician, you cannot independently determine the appropriateness of the cold pack without consulting with the supervising physical therapist, and then immediately inform the PT of Mr. Ramirez's request. Explanation. Why B is correct. PT technicians operate under the direct supervision of licensed physical therapists. Applying therapeutic modality, even seemingly benign, one like cold, requires assessment by the PT to determine its appropriateness for the patient's specific condition and stage of healing following TK. Mr. Ramirez has palpable warmth and edema, which could contraindicate the use of cold. The decision to apply cold requires clinical judgment that falls outside the PT technician's scope. Informing the PT immediately is the correct action. YA is incorrect. Applying the cold pack without PT approval. Direct violation of the PT technician's scope of practice and could potentially harm the patient. The palpable warmth and edema suggest potential inflammation, and cold may not be the most appropriate intervention without further assessment. Furthermore, the TI must act under the direction of the PT. YC is incorrect. While well-intentioned, simply declining the request without informing the supervising PT delays potentially beneficial treatment. Misses an opportunity to address the patient's concerns. The PT should be made aware of the patient's request and the technician's inability to assist in case the PT deems the treatment is required. YD is incorrect. Checking for contraindications is good practice, but it does not override the need for the PT to assess the patient and determine the appropriateness of the intervention. Even if no contraindications are found, the PT must approve the application. Question 2. Therapeutic exercises. Exercise program development and progression. A patient is performing seated rows using a resistance band as part of a progressive strengthening program targeting the scapular retractors, rhomboids, and middle trapezius. The patient is currently using a yellow resistance band and can perform 3 sets of 15 repetitions with good form and minimal fatigue. To appropriately progress this exercise and continue to challenge the patient's strength, which following modifications would be most effective and in line with the principles of progressive overload. A. Increase the number of repetitions to 20 per set, maintaining the same yellow resistance band. B. Decrease the rest time between sets from 60 seconds to 30 seconds, maintaining the same yellow resistance band and number of repetitions. C. Switch to a green resistance band, which provides greater resistance, and maintain the same number of sets and repetitions. D. Instruct the patient to perform the seated rows at a faster pace to increase power output, maintaining the same yellow resistance band and number of repetitions. Answer. C. Switch to a green resistance band, which provides greater resistance and maintain the same number of sets and repetitions. Detailed explanation. This question examines your understanding of the principles of progressive overload, which is fundamental to strength training and rehabilitation. YC is correct. Switching to a green resistance band directly increases the load resistance on the muscles. According to the overload principle, muscles must be subjected to a stimulus greater than what they are accustomed to in order to stimulate adaptation and strength gains. Maintaining the same number of sets and repetitions with a higher resistance band ensures the patient is challenged without drastically altering the exercise parameters. YA is incorrect. While increasing repetitions is a form of progression, it primarily challenges muscular endurance rather than strength. Since the goal is to increase strength, persistence is a more effective approach at this stage. YB is incorrect. Decreasing rest time primarily challenges cardiovascular fitness and muscular endurance. While it can be a useful progression strategy, it does not directly address the goal of increasing strength. YD is incorrect. Increasing the speed of movement can increase power output, but it also increases the risk of improper form and injury, especially with a weakened or musculature. The focus at this stage should be on controlled, high-resistance movements to build strength. Question 3. Electrical stimulation. Indications and contraindications. Which of the following conditions is a most likely contraindication for the application of neuromuscular electrical stimulation (NMES) to the quadriceps muscle group? A. Chronic low back pain with associated muscle spasm. B. Muscle weakness following prolonged immobilization due to a cast. C. A patient with a demand-type cardiac pacemaker. D. A patient with significant edema in the lower extremity due to venous insufficiency. Answer C. A patient with a demand-type cardiac pacemaker. Detailed explanation. This question tests your understanding of the contraindications for electrical stimulation, which are essential for patient safety. YC is correct. Cardiac pacemakers are a major contraindication for NMES. Electrical stimulation can interfere with the function of a demand-type pacemaker, potentially causing it to malfunction and posing a serious risk to the health. The electrical current from the NMES can be falsely interpreted by the pacemaker as a normal heart signal, causing it to withhold pacing when it is needed. YA is incorrect. NMES can be used cautiously to help reduce muscle spasm associated with chronic low back pain. It is not typically a contraindication, although careful electrode placement and monitoring are essential. YB is incorrect. Muscle weakness following immobilization is a common indication for NMES. NMES can help to stimulate muscle contraction and improve strength. YD is incorrect. While significant edema can sometimes be a relative contraindication due to altered tissue conductivity, it is not an absolute contraindication like a pacemaker. The PT would need to carefully assess the patient and adjust the parameters of the NMES accordingly. Question 4. Therapeutic modalities. Heat modalities. A 55-year-old patient presents to the clinic with chronic shoulder pain and stiffness secondary to adhesive capsulitis, frozen shoulder. The physical therapist has determined that heat modalities are appropriate to increase tissue extensibility prior to range of motion exercises. Considering the patient's condition and the need for both superficial and deeper tissue heating, which of the following modalities would be most appropriate and effective for achieving the desired therapeutic effects? A. Moist hot packs applied for 20 minutes, followed by active range of motion exercises. B. Paraffin wax immersion for 15 minutes, followed by passive stretching performed by the physical therapy technician. C. Continuous ultrasound at 1 MHz frequency for 8 minutes, targeting the rotator cuff muscles and joint capsule. D. Infrared lamp irradiation for 30 minutes, followed by isometric strengthening exercises. Answer C. Continuous ultrasound at 1 MHz frequency for 8 minutes, targeting the rotator cuff muscles and joint capsule. Detailed explanation. This question tests your understanding of the depth of penetration and physiological effects of various heat modalities and their appropriateness for different conditions. YC is correct. Continuous ultrasound at 1 MHz frequency is the most effective option for achieving deeper tissue of the rotator cuff muscles and joint capsule, which are the primary structures affected in adhesive capsulitis. The 1 MHz frequency allows for deeper penetration up to 5 centimeters, and continuous mode ensures a sustained thermal effect. This increased tissue temperature enhances extensibility, making range of motion exercises more effective. YA is incorrect. Moist hot packs provide superficial heat, which may help to superficial muscles, but they do not penetrate deep enough to significantly affect the rotator cuff muscles and joint capsule in adhesive capsulitis. YB is incorrect. Paraffin wax is hollow. A superficial heat modality. While it can be soothing and help with pain relief, it is not effective for heating the deeper tissues affected in adhesive capsulitis. Passive stretching by the technician is also not the primary approach for increasing ROM. Adhesive capsulitis, active or active-assisted ROM is usually preferred. Why? D is incorrect. Infrared lamps provide superficial heat and are not as effective as ultrasound for heating deeper tissues. Isometric strengthening exercises are not the initial focus in adhesive capsulitis. The primary goal is to restore range of motion. Question 5. Assistive devices in gait training. A 72-year-old woman, MS Chen, is being discharged from an inpatient rehabilitation facility following a hip fracture. She has fair balance and decreased weight-bearing tolerance on the affected leg. The physical therapist has prescribed a standard walker for ambulation. Which of the following instructions is most important for the PT technician to emphasize to MS Chen regarding the safe, effective use of the walker? A. Advance the walker a large step ahead of her, then step forward with the affected leg first, followed by the unaffected leg. B. Lift the walker with each step to ensure adequate clearance and prevent tripping, focusing on speed and efficiency of ambulation. C. Advance the walker a short distance, ensuring all 4 feet of the walker are firmly planted on the ground before stepping forward, placing the affected leg first, then the unaffected leg. D. Walker primarily for balance assistance, placing minimal weight through her arms and focusing on maintaining a normal gait pattern. Answer. C. Advance the walker short distance, ensuring all 4 feet of the walker are firmly planted on the ground before stepping forward, placing the affected leg first, then the unaffected leg. Detailed explanation. This question focuses on the safe and effective use of assistive devices, particularly in a patient with decreased weight-bearing tolerance. Why C is correct. Advancing the walker a short distance and ensuring all 4 feet are firmly provides a stable base of support. Stepping forward with the affected leg first allows MS Chen to maintain partial weight bearing on the walker and protect her healing hip. Following with the unaffected leg completes the step. YA is incorrect. Advancing the walker too far ahead can create instability and increase the risk of falls. It also requires the patient to reach too far, which can be problematic after a hip fracture. B is incorrect. The walker with each step is inefficient and increases the risk of losing balance. Walkers are designed to provide a stable, grounded support. D is incorrect. While balance is important, the primary purpose of the walker in this scenario is to provide weight-bearing support. Minimizing weight through the arms would negate the benefit of the walker and potentially overload the healing hip. Question 6. Documentation and legal considerations. You are a ET technician assisting a physical therapist in the treatment of a patient with a lumbar strain. During the session, the patient reports a sudden increase in low back pain radiating down the left leg after performing a set of lumbar extension exercises. The physical therapist is currently occupied with another patient and unable to immediately assess the situation. What is the appropriate course of action for the PT technician to take considering documentation and legal considerations? A. Immediately stop the exercise, reassure the patient, and document the incident in the patient's chart as patient reported increased pain with exercise. B. Apply ice to the patient's low back, instruct them to rest, and inform the physical therapist about the incident after their other patient is finished. C. Immediately stop the exercise, notify the physical therapist of the patient's report of increased pain, and accurately document the objective report, the exercises performed, and the notification of the physical therapist in the patient's chart. D. Ask the patient if they would like to continue with a different exercise to avoid further aggravating the pain, and document the change in the patient's chart at the end of the session. Answer. C. Immediately stop the exercise, notify the physical therapist of the patient's report of increased pain, and accurately document the patient's subjective report, the exercises performed, and the notification of the physical therapist in the patient's chart. Detailed explanation. This question highlights the importance of accurate and timely documentation, communication with the supervising PT, and patient safety. Why C is correct. The technician must first and foremost ensure patient safety by stopping the exercise that caused the pain. Notifying the PT immediately is crucial, as the patient's report suggests a potential nerve root irritation or other serious problem. Accurate documentation is essential for legal protection and continuity of care. The documentation must include the patient's subjective report, the specific exercise performed, and the notification of the physical therapist. YA is incorrect. While stopping the exercise and reassuring the patient is important, simply documenting increased pain with exercise is insufficient. The documentation must be detailed and accurate. The other element missing is informing the PT why B is incorrect. Applying ice without the PT's assessment and instruction is outside the scope of practice for a TT technician. Waiting until the PT is finished with another patient delays potentially necessary intervention. The PT technician must notify the PT immediately why D is incorrect. Changing the exercise without the PT's assessment and instruction is inappropriate and potentially harmful. Patient's report of radiating pain requires further evaluation by the PT before any further exercises are performed. Question 7. Common neurological conditions and rehabilitation. A patient recovering from a stroke, CVA, exhibits left-sided hemiparesis and demonstrates significant difficulty with functional reaching activities. The physical therapist has prescribed interventions to improve upper extremity motor control and coordination. Which of the following exercises would be most appropriate for addressing this patient's functional reaching deficits? A. Bicep curls with a 5-pound dumbbell to strengthen the affected arm. B. Wrist extension exercises using a resistance band to improve wrist stability. C. Constraint-induced movement therapy, CIMT, involving repetitive task practice with the unaffected arm constrained. D. Reaching for objects of varying sizes and distances while seated, focusing on trunk stabilization and control movement of the affected arm. Answer: D. Reaching for objects of varying sizes and distances while seated, focusing on trunk stabilization and controlled movement of the affected arm. Detailed explanation. This question focuses on the principles of neurorehabilitation and the selection of appropriate exercises to address specific functional deficits after a stroke. Why D is correct. Reaching for objects of varying sizes and distances is a functional activity that addresses the patient's reaching deficits. Focusing on trunk stabilization and controlled movement of the affected arm promotes motor relearning and improves coordination, which are essential for recovery after a stroke. The movement and task can be modified to be achievable by the patient. YA is incorrect. While strengthening the biceps is important, it does not directly address the complex coordination and motor control deficits required. Functional reaching. Isolated strengthening exercises are typically not the primary focus in neurorehabilitation. YB is incorrect. Wrist stability is important, but it is only one component of functional reaching. Addressing the entire reaching movement pattern is more effective than focusing solely on wrist extension. YC is incorrect. CIMT can be beneficial for some stroke patients, but it requires a specific protocol and careful patient selection. It is always the most appropriate initial intervention for all patients with hemiparesis. CIMT typically requires a degree of active movement and may be too difficult for some patients initially. Question 8. Exercise program development. Progressive overload. A patient is performing bridging exercises as part of a rehabilitation program for gluteal weakness. They can currently perform 3 sets of 15 repetitions with good form. To appropriately progress this exercise and continue to challenge the patient's gluteal muscles, which of the following modifications would be most effective? A. Reduce the rest time between sets from 60 seconds to 30 seconds. B. Increase the number of repetitions to 25 per set. C. Add a resistance band around the patient's knees during the bridging exercise. D. Perform the bridging exercise on a more stable surface. Answer: C. Add a resistance band around the patient's knees during the bridging exercise. Detailed explanation. This question assesses your understanding of applying progressive overload principles to a common therapeutic exercise. YC is correct. Adding a resistance band around the knees increases the difficulty of the exercise by requiring the patient to abduct their hips against resistance while performing the bridge. This directly increases the activation of gluteal muscles and challenges their strength. YA is incorrect. Reducing rest time primarily challenges muscular endurance rather than strength. While it can be a useful progression, it's not the most effective way to increase gluteal strength in this case. YB is incorrect. Increasing repetitions primarily targets muscular endurance, while some strength gains can occur. Is not as effective as increasing the resistance. The PT should focus on resistance and proper form when strengthening is the goal. D is incorrect. A more stable surface would decrease the challenge to the gluteal muscles, as they would have to work less to maintain stability. Question 9. Therapeutic modalities. Cold modalities and contraindications. A 48-year-old patient is referred to physical therapy for lateral epicondylitis. The physical therapist has decided to use ice massage as part of the treatment plan to manage pain and inflammation. Which of the following patient statements should prompt the PT technician to immediately inform the physical therapist before initiating the ice massage? A. I have a slight tingling in my fingers sometimes, but it usually goes away quickly. B. I had a total knee replacement about 5 years ago. C. I have a history of Raynaud's phenomenon in my hands and feet. D. I usually take ibuprofen for my pain, and it seems to help. Answer C. I have a history of Raynaud's phenomenon in my hands and feet. A detailed explanation. This question tests your knowledge of contraindications for cold modalities, particularly ice massage, and the importance of patient screening. Why C is correct. Raynaud's phenomenon is a condition in which blood vessels, usually in the fingers and toes, constrict excessively in response to cold or stress. This can lead to decreased blood flow and tissue damage. Cold modalities are contraindicated in patients with Raynaud's phenomenon. The PT technician must inform the physical therapist immediately before initiating ice massage, as it could exacerbate the patient's Raynaud's symptoms. Y is incorrect. Occasional tingling in the fingers is not necessarily a contraindication for ice massage, although the PT technician should still inform the physical therapist. The PT should perform testing to rule out any other potential underlying pathologies. B is incorrect. A history of total knee replacement is not a contraindication for ice massage to the lateral epicondyle. D is incorrect. Taking ibuprofen is not a contraindication for ice massage, although it is important to document the patient's medication use. Question 10. Common musculoskeletal conditions and interventions. A 35-year-old patient presents to the clinic with complaints of anterior knee pain that is exacerbated by prolonged sitting, squatting, and descending stairs. Based on the patient's symptom presentation, the physical therapist suspects patellofemoral pain syndrome, PFPS. Which of the following interventions would be most appropriate for the physical therapy technician to assist with under PT's direction as part of the patient's treatment plan? A. Application of ultrasound to the lateral retinaculum to reduce tissue extensibility. B. Instruction and exercises to strengthen the vastus medialis oblique (VMO) muscle, such as isometric quadriceps with biofeedback. C. Application of patellar mobilization techniques to improve lateral patellar glide. D. Instruction in hamstring stretching exercises to increase hamstring tightness. Answer B. Instruction in exercises to strengthen the vastus medialis oblique (VMO) muscle, such as isometric quadriceps with biofeedback. Detailed explanation. This question assesses your understanding of common interventions for patellofemoral pain syndrome, PFPS, and the role of the PT technician. B is correct. Strengthening the vastus medialis oblique (VMO) is a key component of PFPS treatment. The V helps to stabilize the patella and prevent lateral tracking. Isometric quadriceps with biofeedback can be an effective way to target and strengthen the VMO. A PT technician can assist with instructing the patient in these exercises under the direction of the PT. YA is incorrect. Ultrasound is not typically used to reduce tissue extensibility. It can be used to promote healing or reduce pain and inflammation. YC is incorrect. Patellar mobilizations are typically performed by the physical therapist, not the PT technician, as they require specialized training and assessment skills. YD. Incorrect. Hamstring tightness can contribute to PFPS in some cases, but the primary focus is typically on strengthening the VMO and addressing other biomechanical factors. Strengthening of the VMO, a direct and more effective approach. Question 11. Assistive devices and safety. Mrs. Davison, an 80-year-old patient with a history of recurrent falls and osteoarthritis in both knees, is prescribed a rolling walker. While instructing Mrs. Davison on the proper use of the walker, what is the most important safety instruction to emphasize to minimize her risk of falls? A. Lean forward slightly when walking to propel the walker forward and use momentum to maintain a consistent pace. B. Ensure the walker is advanced no more than a small step's length ahead and that all four wheels are in contact with the ground before taking a step. C. Keep the walker close to the body and focus on lifting the legs high with each step to clear any potential obstacles. D. Use the walker primarily as a visual cue, lightly onto the hand while maintaining a normal walking pattern. Answer B. Ensure the walker is advanced no more than a small step's length ahead and that all four wheels are in contact with the ground before taking a step. Detailed explanation. This question emphasizes safe use of assistive devices, particularly for patients at high risk for falls. B is correct. Rolling walkers offer less stability than standard walkers if not used correctly. Advancing it only a short distance provides a stable base of support. and reduces the risk of overreaching. Ensuring all wheels are in contact with the ground minimizes the risk of the walker rolling away or tipping. YA is incorrect. Leaning forward creates an unstable posture and increases the risk of falls, especially for someone with balance issues and osteoarthritis. Momentum is not a safe way to maintain a consistent pace. YC is incorrect. Lifting legs high increases energy expenditure and might be difficult for someone with osteoarthritis. Also, it can lead to a loss of balance. YD is incorrect. This approach negates the weight-bearing support that the walker is intended to provide. It essentially turns the walker into a useless and potentially dangerous object. Question 12. Patient assessment and communication. During a therapy session, a patient expresses frustration about their slow progress following a total hip replacement. They state, "Well, I feel like I'm never going to get back to normal." Or, what is the most appropriate response by the physical therapy technician? A. If I understand your frustration, it's normal to feel this way after surgery. Just keep working hard and you'll get there eventually. B. Don't worry, you're doing great. Everyone progresses at their own pace. Just be patient and you'll see results soon. C. I can see that you're feeling discouraged. Recovery can be challenging. I'll make sure to communicate your concerns to the physical therapist so we can adjust your plan if needed. D. You're right. It is a slow process, but you're much further along than other patients I've seen with similar surgeries. Answer C. I can see that you're feeling discouraged. Recovery can be challenging. I'll make sure to communicate your concerns to the physical therapist so we can adjust your plan if needed. Detailed explanation. This question tests your communication skills and ability to respond empathetically and professionally to a patient's concerns. YC is correct. This response acknowledges the patient's feelings, validates their experience, and offers a action communicating with the PT. It is empathetic, professional, and within the PT technician's scope of practice. The focus is placed on making sure that the patient is cared for and their concerns are heard. YA is incorrect. While somewhat empathetic, it's a generic response that doesn't address the patient's specific concerns or offer a solution. Also, statements such as "the patient will get there eventually" are too abstract. YB is incorrect. This response dismisses the patient's feelings and offers empty reassurance. Progress is not simply a matter of patience and platitudes. YD is incorrect. Comparing the patient to others is inappropriate and potentially demoralizing. It can also violate patient confidentiality. Question 13. Therapeutic modalities and contraindications. Electrical stimulation. A patient with a history of deep vein thrombosis (DVT) in the lower extremity is being considered for neuromuscular electrical stimulation (NS) to address quadriceps weakness following knee surgery. What precaution is most crucial to observe when applying NS to this patient? A. Use low-intensity stimulation with short on-off cycles. B. Avoid placing electrodes directly over the site of the previous DVT. C. Apply a compression bandage to the lower extremity during stimulation. D. Monitor the patient's blood pressure closely during the NMES treatment. Answer B. Avoid placing electrodes directly over the site of the previous DVT. Detailed explanation. This question focuses on the crucial precautions necessary when using electrical stimulation on a patient with a history of DVT. Y. B is correct. While a resolved DVT is no longer an absolute contraindication, placing electrodes directly over the site of the previous DVT poses a potential risk of dislodging residual thrombus material or irritating the vessel wall, potentially leading to a new DVT. Therefore, it's crucial to avoid direct electrode placement over this area. YA is incorrect. While using low-intensity stimulation and short on-off cycles is generally a good practice, it doesn't specifically address the risk of DVT. YC is incorrect. Applying a compression bandage is not directly related to the DVT risk and actually impedes circulation. YD is incorrect. Monitoring blood pressure is always good practice, but it's not the primary concern related to the DVT risk. Question 14. Common musculoskeletal conditions and exercise. A patient is diagnosed with subacromial impingement syndrome. The physical therapist has designed a treatment plan emphasizing scapular stabilization exercises. Which exercise would be most appropriate for the PT technician to instruct the patient on initially to promote proper scapular motion and reduce impingement? A. Dumbbell shoulder press to strengthen the deltoids. B. Lateral raises with heavy resistance to build shoulder abduction strength. C. Scapular retractions, scapular squeezes, focusing on squeezing the shoulder blades together without elevating the shoulders. D. Push-ups against a wall to improve pectoral muscle strength and posture. Answer C. Scapular retractions, scapular squeezes, focusing on squeezing the shoulder blades together without elevating the shoulders. Detailed explanation. This question examines knowledge of interventions for impingement syndrome, particularly the initial focus on scapular stabilization. Why C is correct. Scapular retractions, scapular squeezes are a fundamental exercise for improving scapular stability and posture by strengthening the retractors, rhomboids, and middle trapezius. This exercise helps to pull the scapula back and down, creating more space in the subacromial space and reducing impingement. It also helps in maintaining a normal posture. YA is incorrect. While deltoid strengthening is important for shoulder function, it is not the initial focus in impingement syndrome. Addressing scapular mechanics is typically prioritized first. YB is incorrect. Lateral raise, especially with heavy resistance, can exacerbate impingement symptoms if scapular mechanics are not addressed first. YD is incorrect. Push-ups can be a helpful exercise, but wall push-ups are primarily focused on the pectoral muscles. Wall push-ups also help to reduce the impingement, but in this case, the question is to focus on initial promotion of scapular motion, hence the correct answer should be scapular squeezes. Question 15. Documentation and ethical considerations. A patient refuses to perform an exercise prescribed by the physical therapist, stating they are in too much pain. The physical therapist is unavailable to address the situation immediately. What is the most appropriate action for the PT technician to take considering ethical and documentation requirements? A. Persuade the patient to try the exercise again, emphasizing its importance for their recovery, and document the patient's participation. B. Respect the patient's refusal, offer an alternative exercise, and document the change in the treatment plan in the patient's chart. C. Respect the patient's refusal, inform the physical therapist as soon as possible, and accurately document the patient's refusal, the reason given, and the communication with PT in the patient's chart. D. Discontinue the treatment session and reschedule the patient for another appointment when the physical therapist is available. Answer C. Respect the patient's refusal, inform the physical therapist as soon as possible, and accurately document the patient's refusal, the reason given, and the communication with the PT in the patient's chart. Detailed explanation. This question focuses on ethical considerations, patient rights, and proper documentation. Why C is correct. Patient autonomy is paramount. The PT technician must respect the patient's refusal to perform the exercise. Informing the PT is crucial as they can assess the situation and modify the treatment plan accordingly. Accurate documentation is essential for legal protection and continuity of care. YA is incorrect. Persuading the patient against their will is unethical and violates their right to refuse treatment. YB is incorrect. Offering an alternative exercise without consulting the PT is outside the scope of practice for technician. The PT should direct alternative actions. YD is incorrect. Discontinuing the session is unnecessary. The technician can provide other aspects of the treatment plan that the patient is willing to participate in, and the documentation of refusal is a more important first step before discontinuing the plan. Question 16. Exercise program development and progression. Endurance training. A patient recovering from a myocardial infarction heart attack is participating in a cardiac rehabilitation program. They are currently able to walk on a treadmill at 2 miles per hour for 20 minutes with no significant symptoms. Which of the following is the most appropriate way to progress this patient's treadmill walking program to improve cardiovascular endurance? A. Increase the treadmill speed to 3 miles per hour while maintaining the 20-minute duration. B. Increase the incline of the treadmill to 5% while maintaining the 2 miles per hour speed and 20-minute duration. C. Increase the duration of the treadmill walking to 30 minutes while maintaining the 2 miles per hour speed and 0% incline. D. All of the above are appropriate ways to progress the patient's treadmill walking program. Answer D. All of the above are appropriate ways to progress the patient's treadmill walking program. Detailed explanation. This question assesses the understanding of appropriate progression strategies in endurance training for a patient with cardiac considerations. YD is correct. All of the options provided are valid and appropriate ways to progress a cardiac rehabilitation patient's treadmill walking program to improve cardiovascular endurance. Selection of one over another depends on the PT's assessment of the patient's response to exercise and individual goals, but each choice could represent an appropriate change, increasing speed. This increases the intensity of the exercise, increasing incline. This increases the intensity of the exercise, engaging more muscles, increasing duration. This increases the time spent exercising, improving endurance. A, B, and C alone are insufficient. Individually, each component fails to recognize the broad range of options available to progress the patient's exercise, especially in consideration to patient's recovery from heart attack, where cardiovascular endurance is the key component to improving the heart and lung functions to perform daily life activities. The PT would assess the patient's ability to maintain appropriate blood pressure and heart rate and use all components to progress, making all them correct individually but not collectively. Question 17. Common neurological conditions and interventions. A patient with Parkinson's disease is experiencing freezing episodes while walking, characterized by a sudden inability to initiate or continue movement. What strategy would be most appropriate for the PT technician to teach the patient to help overcome these freezing episodes? A. Instruct the patient to take small, shuffling steps to maintain momentum and avoid stopping. B. Encourage the patient to focus on a visual cue, such as a line on the floor, and step over it to initiate movement. C. Advise the patient to lean forward slightly when walking to improve their center of gravity. D. Suggest the patient use ankle weights to improve proprioception and stability. Answer: B. Encourage the patient to focus on a visual cue, such as a line on the floor, and step over it to initiate movement. Detailed explanation. This question tests your knowledge of strategies to manage specific symptoms of Parkinson's disease. Why? B is correct. Visual cues, such as lines on the floor or laser pointers, can help patients with Parkinson's disease overcome freezing episodes. Focusing on the visual cue and stepping over can help to trigger the motor system and initiate movement. This strategy bypasses the basal ganglia dysfunction that contributes to freezing. A is incorrect. Small shuffling steps are a characteristic of Parkinson's gait and do not prevent freezing episodes. Instead, they may worsen the problem by decreasing stride length and increasing the risk of falls. C is incorrect. Leaning forward can actually increase the risk of falls in patients with Parkinson's disease, as it disrupts their balance and center of gravity. D is incorrect. Ankle weights may worsen gait problems and increase the risk of falls in patients with Parkinson's disease. Question 18. Practice management and legal considerations. A physical therapy technician witnesses another technician repeatedly violating patient confidentiality by discussing patient information in public areas of the clinic. What is the most appropriate course of action for the PT technician to take? A. Confront the other technician directly and demand they stop violating patient confidentiality. B. Ignore the behavior, as it is not your responsibility to enforce HIPAA regulations. C. Report the behavior to the supervising physical therapist or clinic manager, providing specific details about the violations. D. Document the incidents in a personal log for future reference, but do not take any further action. Answer: C. Report the behavior to the supervising physical therapist or clinic manager, providing specific details about the violations. Detailed explanation. This question emphasizes ethical and legal responsibilities regarding patient confidentiality and HIPAA compliance. C is correct. Reporting the behavior to the supervising PT or clinic manager is the most appropriate action. This allows the appropriate authorities to address the situation and ensure patient confidentiality is protected. The report should include specific details, such as dates, times, and the information disclosed. A is incorrect. While well-intentioned, confronting the other technician directly may not be effective and could create a hostile work environment. Furthermore, it does not ensure that the violations are properly addressed and corrected. B is incorrect. It is the responsibility of all health professionals to protect patient confidentiality and comply with HIPAA regulations. Ignoring the behavior is unethical and potentially illegal. D is incorrect. Documenting the incidents for personal reference is not sufficient. The violations must be reported to the appropriate authorities to ensure patient safety and legal compliance. Question 19. Therapeutic exercises and patient education. A patient is instructed to perform a home exercise program that includes prone press-ups to address low back pain. Which instruction is most important for the PT technician to emphasize to ensure the patient performs the exercise safely and effectively? A. Perform the exercise quickly and forcefully to maximize the stretching effect. B. Keep the hips in contact with the floor and only extend the upper back as far as comfortable, avoiding pain. C. Hold the extended position for 30 seconds to promote muscle relaxation and flexibility. D. Perform the exercise multiple times throughout the day to maintain range of motion. Answer: B. Keep the hips in contact with the floor and only extend the upper back as far as comfortable, avoiding pain. Detailed explanation. This question focuses on patient education and safe performance of a common exercise for lower back pain. Why B is correct. Maintaining contact with the floor and only extending the upper back as far as comfortable emphasizes safe execution. The patient must be instructed to avoid pain and excessive which could exacerbate their symptoms. Why A is incorrect. Performing the exercise quickly and forcefully increases the risk of injury. Control and gradual movement are essential. Why C is incorrect. Holding the extended position for 30 seconds is not necessary and may increase the risk of muscle strain. Brief holds G2, 3 seconds are typically sufficient. Why D is incorrect. While performing the exercise multiple times a day beneficial, it is more important to emphasize safe technique and avoiding pain. Frequent exercise may also overload the injury. Question 20. Exercise principles and specificity. A physical therapist is designing a rehabilitation program for a volleyball player recovering from an ankle sprain. The PT wants to incorporate exercises that will best prepare the athlete for the demands of their sport. Which exercise would be most appropriate to include in the program based on the principle of specificity? A. Stationary cycling to improve cardiovascular fitness. B. Open chain ankle exercises with resistance bands to strengthen ankle plantar flexors and dorsiflexors. C. Balance training on a stable surface to improve static balance. D. Plyometric jumping and landing drills to improve power and agility. Answer D. Plyometric jumping and landing drills to improve power and agility. Detailed explanation. This question tests your understanding of the specificity principle in exercise prescription, particularly for sports rehabilitation. Why D is correct. Plyometric jumping and landing drills are the most specific to the demands of volleyball, which involves jumping, landing, and quick changes of direction. These drills help to improve power, agility, proprioception, which are essential for volleyball performance. YA is incorrect. What cardiovascular fitness is important? Stationary cycling is not specific to the movements and demands of volleyball. YB is incorrect. Open chain exercises are important for strengthening individual muscles, but they do not replicate the functional movements of volleyball. YC is incorrect. While balance training is important, balance on a surface does not challenge the athlete's balance in the same way that jumping and landing drills do. Question 20 on therapeutic modalities. Ultrasound and safety. While assisting physical therapist with continuous ultrasound treatment over patient's shoulder, the patient reports feeling deep aching pain during the procedure. What is the most appropriate immediate action for the PT technician to take? A. Increase the intensity of the ultrasound to override the pain signal. B. Continue the treatment at the same intensity, as some discomfort is normal during ultrasound. C. Immediately stop the ultrasound treatment and inform the physical therapist of the patient's report. D. Apply a cold pack to the area being treated to reduce the pain and continue the ultrasound at lower intensity. Answer C. Immediately stop the ultrasound treatment and inform the physical therapist of the patient's report. Detailed explanation. This question tests your understanding of safety protocols during ultrasound application and the importance of patient feedback. Why C is correct. Any report of unusual or worsening pain during ultrasound should be immediately addressed by stopping the treatment and informing the physical therapist. Deep aching pain indicate overheating of tissue, periosteal irritation, or other potential problems. The PT must assess the situation to determine the cause of the pain and adjust the treatment accordingly. YA is incorrect. Increasing the intensity would likely worsen the pain and potentially cause further tissue damage. YB is incorrect. Deep aching pain is not considered normal during ultrasound and warrants immediate attention. YD is incorrect. Applying PAC without the PT's assessment is outside the scope of practice for PT technician. The underlying cause of the pain needs to be determined before any further intervention is applied. Question 22. Exercise prescription. Postural correction. Patient presents with forward head posture and rounded shoulders. The physical therapist has prescribed home exercise program to address these postural impairments. Which of the following exercises would be most appropriate for the PT technician to instruct the patient on to promote improved posture? A. Cervical extension exercises with resistance band. B. Chest stretches in doorway combined with scapular retractions, scapular squeezes. C. Abdominal crunches to strengthen the core muscles. D. Lat pull downs with heavy weight to strengthen the back muscles. Answer B. Chest stretches in A doorway combined with scapular retractions, scapular squeezes. Detailed explanation. This question tests your knowledge of exercises to address common postural impairments. Why B is correct. Chest stretches in. A doorway helped to lengthen the tight pectoral muscles that contribute to rounded shoulders. Scapular retractions, scapular squeezes strengthen the scapular retractors, rhomboids, and middle trapezius, which help to put shoulders back and improve posture. The goal is to stretch the tight muscles and contract the weak muscles. YA is incorrect. While cervical extension exercises may help to improve neck posture, they do not address the rounded shoulders, which is a key component of the patient's postural impairment. YC is incorrect. Abdominal crunches primarily strengthen the abdominal muscles and do not directly address the forward head posture or rounded shoulders. D is incorrect. Lat pull downs can strengthen the back muscles, but they do not directly address the tight pectoral muscles that contribute to rounded shoulders. They also may exacerbate the forward shoulder posture. Question 23. Patient confidentiality and hypoviolations. A technician accidentally leaves a patient's medical chart open on a treatment table while stepping away to retrieve equipment. Another patient sees the open chart and reads some of the information. What is the most appropriate course of action for the PT technician to take? A. Immediately retrieve the chart and warn the other patient not to discuss what they saw with anyone. B. Explain to both patients that it was an accident and assure them that patient privacy is the top priority. C. Immediately retrieve the chart, report the incident to the supervising physical therapist or clinic manager and document the incident in an incident report. D. Ignore the incident as it was an accident and the other patient is unlike. Remember the information they saw. Answer. C. Immediately retrieve the chart, report the incident to the supervising physical therapist or clinic manager, and document the incident in an incident report. Detailed explanation. This question focuses on responding to a potential HIPAA violation and the importance of reporting incidents. Why C is correct. Any potential breach of patient confidentiality, even accidental, must be reported to the supervising PT or manager. An incident report should be completed to document the details of the incident and the steps taken to address it. This allows the clinic to assess the risk and take appropriate corrective actions. YA is incorrect. Warning the other patient is not sufficient. The breach of confidentiality has already occurred, and the incident needs to be reported to the appropriate authorities. YB is incorrect. Explaining the situation is important, but it negates the need to report the incident and take corrective actions. YD is incorrect. Ignoring the incident is a violation of HIPAA and could have serious consequences. Question 24. Common musculoskeletal conditions and interventions. Plantar fasciitis. A patient presents with plantar fasciitis. The physical therapist has prescribed a treatment plan that includes stretching exercises. What stretching exercise would be most appropriate for the PT technician to instruct the patient on? A. Hamstring stretches using a towel. B. Calf stretches, gastrocnemius and soleus holding onto a wall. C. Quadriceps stretches in standing. D. Iliotibial band stretches using a foam roller. Answer. B. Calf stretches, gastrocnemius and soleus holding onto a wall. Detailed explanation. This question tests your understanding of appropriate interventions for plantar fasciitis. Why B is correct. Calf stretches targeting both the gastrocnemius and soleus muscles are a key component of plantar fasciitis treatment. Tight calf muscles contribute to plantar fasciitis by increasing tension on the plantar fascia. Stretching these muscles help reduce tension and alleviate pain. YA is incorrect. Hamstring stretches are important for overall flexibility, but they do not directly address the underlying cause of plantar fasciitis. YC is incorrect. Quadriceps stretches are important for knee function, but they are not directly related to plantar fasciitis. YD is incorrect. Band stretches may be helpful for some patients with lateral knee pain, but they are not related to plantar fasciitis. Question 25. Assistive devices and gait training. A patient with right hemiparesis post-stroke is using a quad cane for ambulation. Which of the following is the most appropriate way for the PT technician to instruct the patient on using the quad cane for maximum stability and safety? A. Hold the cane in the right hand, affect its side, and advance it simultaneously with the left leg. B. Hold the cane in the left hand, unaffect its side, and advance it simultaneously with the right leg, affect its side. C. Hold the cane in either hand, whichever feels most comfortable, and advance it before each step. D. Use the cane primarily for balance, touching it lightly to the ground with each step without placing much weight on it. Answer: B. Hold the cane in the left hand, unaffected side, and advance it simultaneously with the right leg, affected side. Detailed explanation. This question assesses your understanding of proper cane usage for a patient with hemiparesis. Why B is correct. Holding the cane in the unaffected left hand and advancing it simultaneously with the affected right leg provides the most stability and support. The cane acts as a wider base of support to help compensate for the weakness on the affected side. When the affected leg swings forward, the cane is also forward, providing support for weight bearing. YA is incorrect. Holding the cane on the affected side provides less stability and support. It also does not allow the cane to assist with weight bearing during the swing phase of the affected leg. YC is incorrect. The cane should always be held in the hand opposite the affected leg for optimal stability. Support. YD is incorrect. While balance is a factor, the cane's primary function is to provide weight-bearing support and stability. Question 26. Electrical stimulation and electrode placement. You are assisting the physical therapist with MS treatment to the quadriceps muscle to improve knee extension strength. Which of the following electrode placements is most appropriate to maximize quadriceps muscle contraction? A. Place one electrode over the motor point of the vastus medialis oblique, VMO, and the other electrode over the lateral hamstring muscles. B. Place one electrode over the motor point of the rectus femoris and the other electrode over the motor point of the vastus lateralis. C. Place both electrodes close together over the distal portion of the rectus femoris muscle. D. Place one electrode over the tibial nerve and the other electrode over common peroneal nerve. Answer: B. Place one electrode over the motor point of the rectus femoris and the other electrode over the motor point of the vastus lateralis. Detailed explanation. This question assesses your knowledge of appropriate electrode placement for MS. Why B is correct. Placing one electrode over the motor point of the rectus femoris and the other electrode over the motor point of the vastus lateralis will effectively stimulate both major components, quadriceps muscle group, leading to a strong and balanced contraction. Motor points at locations where the nerve enters the muscle, and stimulation at these points elicits the strongest contraction. YA is incorrect. Placing one electrode over the hamstrings would stimulate knee flexion, not extension. YC is incorrect. While placing electrodes close together can stimulate the muscle, it is less effective than placing them over the motor points. Y is incorrect. Stimulation of the tibial and common peroneal nerves would result in ankle and foot movements, not knee extension. Question 27. Hyporegulations and patient information. A physical therapy technician receives a phone call from a patient's employer requesting information about the patient's work restrictions following a back injury. What is the most appropriate response by the PT technician? A. Provide the employer with the requested information as they are paying for the patient's treatment. B. Ask the employer to fax a signed authorization form from the patient before releasing any information. C. Inform the employer that you are unable to provide any information without the patient's written consent and suggest they contact the patient directly. D. Offer to confirm whether the patient is currently attending physical therapy but decline to provide further details. Answer: C. Inform the employer that you are unable to provide any information without the patient's written consent and suggest they contact the patient directly. Detailed explanation. This question tests your understanding of HIPAA regulations and patient privacy. YC is correct. HIPAA regulations require written authorization from the patient before any protected health information file can be released to a third party, including the employer. PT technician must protect the patient's privacy and cannot provide any information without the patient's consent. The safest course of action is to decline all information. YA is incorrect. The fact that the employer is paying for the treatment does not give them the right to access the patient's medical information. YB is incorrect. While requesting a faxed authorization form is a better approach than providing the information outright, it is still appropriate for a technician to handle file without direct instruction from the PT. A proper authorization should be verified and kept on file. YD is incorrect. Even confirming attendance at physical therapy is considered fire and cannot be released without the patient's consent. Question 28. Exercise progression. Balance training. Patient is performing single leg stance as part of balance training program. They can maintain their balance for 30 seconds with their eyes open on firm surface. What is the most appropriate way to progress this exercise to further challenge the patient's balance? A. Have the patient perform the exercise with their eyes closed. B. Have the patient perform the exercise on foam pad. C. Have the patient reach for objects while maintaining single leg stance. D. All of the above are appropriate ways to progress the exercise. Answer: D. All of the above are appropriate ways to progress the exercise. Detailed explanation. This question assesses your understanding of how to progressively challenge balance in a rehabilitation program. Why D is correct. All of the options presented are appropriate progressions to the single leg stance exercise to challenge the patient's balance. Eyes closed, removing visual input increases the challenge to the proprioceptive and vestibular systems. Foam pad. Performing the exercise on an unstable surface requires greater muscle activation and coordination to maintain balance. Reaching for objects. Adding a dynamic component further challenges balance and requires integration of movement and postural control. Why A, B, and C alone are insufficient. Each on their own would not be the best way to perform the training, as it does not take into the account that the patient has to be continually challenged. Each can be modified and be tailored to the patient during the whole session. All should be considered by the PT and tailored by the ability of the patient. Question 29. Common neurological conditions. Stroke. Patient recovering from stroke exhibits shoulder subluxation on the affected side. What intervention is most important for the PT technician to implement to prevent further complications and promote shoulder joint integrity? A. Aggressive range of motion exercises to prevent contractures. B. Use of sling or other support device to maintain proper shoulder alignment. C. Strengthening exercises for the rotator cuff muscles using heavy resistance. D. Application of heat to the shoulder to reduce pain and muscle spasm. Answer: B. Use of a sling or other support device to maintain proper shoulder alignment. Detailed explanation. This question assesses your understanding of managing shoulder subluxation in stroke patients. Why B is correct. A sling or other support device is crucial for maintaining proper shoulder alignment and preventing further subluxation. The sling provides external support to the glenohumeral joint, reducing the downward pull of gravity, weakened arm, and protecting the joint from further injury. YA is incorrect. While range of motion exercises are important, they should be performed gently and cautiously to avoid further stress on the sublux shoulder. YC is incorrect. Strengthening exercises for the rotator cuff muscles are important, but they should be initiated gradually and with appropriate support. To avoid exacerbating the subluxation, you should consider how much weight you earn, which can make the shoulder become more subluxated if you are pulling down. YD is incorrect. Heat can help to reduce pain and muscle spasm, but it does not address the underlying issue of shoulder subluxation. Question 30. Documentation and communication. During a treatment session, a patient reports that they have not been taking their prescribed pain medication because it makes them feel nauseous. What is the most appropriate course of action for the PT technician to take? A. Advise the patient to continue taking the medication as prescribed, as pain control is essential for their rehabilitation. B. Document the patient's statement in the chart and inform the physical therapist about the patient's report. C. Suggest the patient try taking the medication with food to reduce the nausea. D. Recommend an over-the-counter pain reliever as an alternative to the prescribed medication. Answer: B. Document the patient's statement in the chart and inform the physical therapist about the patient's report. Detailed explanation. This question focuses on the proper response to patient medication concerns and communication with the supervising PT. Why B is correct. Documenting the patient's statement and informing the physical therapist is the most appropriate action. The PT needs to be aware of the patient's medication concerns so can communicate with the referring physician and determine the best course of action. YA is incorrect. PT technicians cannot provide medical advice or instruct patients to continue taking medication against their will. YC is incorrect, suggesting a change in how the medication is taken is also considered medical advice and is outside the scope of practice for a T technician. YD is incorrect, recommending an alternative medication considered prescribing and is outside the scope of practice for a PT technician.